Welcome, everyone, to another edition of the Sports Medicine Update, a weekly podcast with yours truly, Jerry Riles, and the fabulous, sensational Dr. Chad Prodromos. Doc, how are you?
I'm great, Jerry. How you doing?
I'm doing fantastic, and we're in week 11 as far as the National Football League is concerned, and the numbers of COVID-19 continue to make its way around, not only in the NFL, but around the world of sports, as we've seen this past weekend. A lot of collegiate sports, football games have been canceled. One close to home and close to the heart, the Ohio State Buckeyes, who were to take on the fighting Illini of Illinois, and Lovie Smith's team, unfortunately had to cancel their game due to COVID-19. But we move forward and we battle through, and the beauty of it is the fact that there's sports on television every weekend thus far that we can certainly lock into. And another feature here in Chicago on the gridiron, our beloved Chicago Bears will be heading up to Lambeau Field to take on Aaron Rodgers, the future Hall of Famer, and the Green Bay Packers on a Sunday night affair. And Mr. Trubisky has been announced by Matt Nagy to be the starting quarterback for this football game. And we know that he was replaced in week 3 by Nick Foles. Unfortunately, Nick Foles is unable to go because he suffered a hip flexor a couple weeks ago. And now Mitchell gets to start, but he's coming in with a couple shoulder injuries that, he's been nursing over the past few weeks himself. So I'd love for an opportunity to dive in and pick your brain regarding these two quarterbacks for our beloved Chicago Bears and their respective injuries. First, let's take a look at Nick Foles. And again, he went down with what was called a hip flexor. It looked a lot ugly and a lot worse than what the end results were. But break it down for our viewers here on the podcast, whether they're listening or watching, regarding hip flexors.
Sure. Actually, it's called a hip pointer. And it's called that because you hit an area. It's not actually the hip joint, and it's at the point of a bone, and it's just been called that kind of forever. So what it is, if you that's what they call it. I'm assuming that's what it, an accurate diagnosis from what's in the media. But if you put your hand at your waist, like where your belt is, and just below where your waist is, there's a bone on either side where it's hard. Your stomach's soft, below that's a bone on either side. So that's the iliac bone, and the top of it where you feel it, if you just put your hand right at your side, just below your waist, that hard bony thing, it's called the iliac crest. It's the crest of the top of the bone. So anytime there's bone that's close to the skin, and you hit it, or you hit what we call soft tissue over it, it hurts like crazy. Kind of like your shin, a little different, but kind of like that. So in a hip pointer, you land right on it, and the bone bruises, and there are muscles from your abdomen that attach to it, and it is just known for being very painful. And he was in obvious pain when it happened. I know it kind of everybody was worried when it happened, and he was taken off in a cart. And then when they found out there was nothing broken and it was a hip pointer, I know it was treated dismissively a little here and there in some of the media, as though, wow, he was writhing in pain and that's all it is, because it's essentially a bruise of the area. But just want to let everybody know, it is known for being just an extremely painful condition, something it's hard to play or practice with. So I think his degree of pain was accurate. The next question is 2 weeks later, is it still appropriate or expected that he wouldn't be able to go? And it kind of depends. I mean, the thing of it is, he's not an accountant. Nothing against accountants, but he's not sitting in a chair at a computer. He's a guy running around a field. So it's one thing to not have bones sticking out through the skin. It's another thing to be able to play through it. And so I don't think it's out of the ordinary that he's not ready to go. It actually brings up another question too, which is, how do you treat it? And in general, the best way to treat it is just to leave it alone and get it to heal. There are kind of avant-garde treatments. We treat things like this with platelet-rich plasma sometimes. But here's the thing. In days gone by, that would have gotten injected with cortisone for sure. And probably that isn't happening, or lidocaine actually. So I should distinguish. Cortisone can help things quiet down sooner over a course of a few days. Lidocaine Novocaine is something that you do right before the game, or there's other kinds, Marcaine, there's other kinds of anesthetics to numb the area. And that used to be done all the time. It's done much less now. I think it's a good thing that it's done much less now. So, I mean, without knowing the details of his condition, I think it's likely, though, from what I do know, that if they wanted him to, he wanted to play, and they wanted to have one of the team physicians inject that area and numb it up, that it would make it much more likely that he could go. However, they're obviously not doing that, and I think it's to their credit that they're not doing it.
Can you make it clear for those again who are watching and listening, and maybe clear it up for me as well? When you say they may shoot them up before, are you saying once the injury has been sustained, you sustain the injury, if for instance they wanted Nick Foles to play as opposed to letting Mitchell Trubisky come in, that they would shoot him up with cortisone or any other shot to get him out there faster? Is that right? What you? Okay.
You can do it one of two ways. So when it happened, let's say you go a couple of days and it's clear that it's pretty severe. At that point, roughly, you could inject him with cortisone. I said I never use cortisone, so let me be clear. I'm not advocating it. I'm just saying that it happens. And so cortisone generally inflames it for a day or two, and then it gets better. So usually 48 hours, maybe 24, maybe 72 hours, it feels better. So that could have been done earlier on. But on the day of the game, you inject it with, we still call it Novocaine, because people know the name, but they are local anesthetics. Lidocaine, Marcaine, probably the two commonest ones. Like if you getting a tooth pulled or whatever, you go to the dentist and they numb it up like that. So, and that just happened. We were talking the other week, and help me with his name, but the quarterback on the San Diego Chargers, who had actually won the starting job, and right on the day of the game, right before the game, they said he couldn't go, and it came out later, this is, 3 weeks ago, that he had rib something, contusions, I don't think they were fractures, and so the team doctor attempted to inject that with a local anesthetic. So it wouldn't be cortisone right before the game, it'd be like Novocaine right before the game, and that can last, there are ones that'll last 3, 4, 5 hours, even longer. But the doctor inadvertently punctured his lung, and it wasn't life-threatening or anything, but he couldn't go that day. Subsequently lost his job to the rookie he had beaten out. I can't remember who that is either, but it was a high draft pick for the Chargers. So I guess it's still being done some. And I know not to criticize the people that do it. If you're doing it, the thought process goes like this. The discussion goes like this. So first of all, the athlete has to want to do it. The athlete has to say, look, is there any way you can get me out in the field? If it's a shot, it's a shot, provided. And then the proviso comes up, provided I'm not going to do long-lasting harm. And then that's a discussion between the athlete and the physician and the trainer and maybe the coach, I don't know. And then you would say something like this. You'd say, well, you wouldn't want to inject, for example, an Achilles tendon, because if you numb that, you're at high risk to rupture it, and that's catastrophic. But if it's a bruise or a contusion, you could make the case, and you could say, well, it's sore, but just by injecting it, you're not going to rupture something that would need surgery. That would be the argument for injecting ribs. That would be the argument for maybe injecting a hip pointer. I've mentioned a couple of times here before that Chris Chelios was injected by the doctor. I think it was his groin, actually, and he inadvertently numbed the nerve so he couldn't go. But so the argument goes, well, if I numb it up and I can play, will I be the worse for it later? Could I be permanently injured? And then it gets to be, who knows, I guess. And it just gets to be a discussion. And the physician says, well, there's always some chance, but I think it's pretty safe. Or physician says, I wouldn't do it because you could risk future injury. And that gets to be a gray area.
And I don't know if this is, your lane, so to speak, as we say, but how much of a factor, because I recall, Michael Jordan and The Last Dance, and you recall when he, was drafted by the Bulls and He broke a bone in his foot, and he wanted to come back. The Bulls wanted him to sit out and just rest, and he wanted to come back. He cut the cast off, and it was revealed in the Last Dance, where Reinsdorf told Mike, hey, we talked to the team physician, the doctor, and it said, you shouldn't go. And the bottom line is, you take this one pill, one chance it can cure you. The other 9 opportunities, 1 out of 10 chances, the other 9 opportunities it can kill you. Would you take the pill? And Michael said, hey, depends on how severe the pain was. How much does that owner factor in to, like, for instance, with a Nick Foles? Does the owner sit down, from your perspective and your experience over the years working with teams? How much of an input does the owner have as far as a player is concerned, and putting them on a shelf or getting them back out there the next week?
So first of all, it's going to vary, and second of all, I wouldn't have firsthand knowledge. I think what usually happens. So in my experience, I used to do an awful lot of team physician work, and when I was younger and running around to games, and as I'd mentioned before, I was the original medical director for the Arena Football League when it started. So in its infancy, I actually did the physicals for all of the teams. And the person who is normally most involved is the coach, because the coaches, and I know, and I'm pretty conservative about people playing with pain, and I know there were some arena football coaches who were maybe not real happy with me, but they're advocating, they're saying, hey, I want this player out there, and any way you can do it, and I'd say no. So it tends to be coaches, I think, and not all coaches, but they're the ones in the front lines. I would doubt that too many owners would interject themselves into that conversation. Some owners are more, Jerry Jones, and I don't know Jerry Jones at all, but Jerry Jones, I think, sort of functions as his own general manager, and or at least to a degree. So one would think, and Jerry Jones played too, played. So you would think that maybe somebody like him might voice an opinion. But I'll tell you, in general, ownership, coaches, everybody, I think they bend over backwards to not offer an opinion. And these days, I don't mean to imply that Jerry Jones is. I'm sure he doesn't, actually. But the thing that happens is, there's always an inherent conflict. And it used to be, even when I used to do a lot more for, anytime you're a team physician, it's kind of a funny concept. So I was team physician we had this huge enterprise, all these high schools, colleges, pro teams, the arena team. I was the team physician for the pro indoor soccer team with the Chicago Power, with Karl-Heinz Granitz, all these guys. Anyway, the athletes always view, even now, team physicians suspiciously. Because now it used to be, it's interesting, way back when, team physicians used to be paid by the teams. But then it became sort of clear that being a team physician for a high-profile team was kind of a marketing benefit for a physician, because the implication is the physician knows what he's doing. And the thing has changed, what would it be, 180 degrees? Because it used to be they used to pay them, and then they stopped paying them. And then it became the case, which is kind of the way it works now, that actually the medical people pay the teams. They don't pay them a salary, but they wind up usually spending money for marketing purposes. And I know back when I was doing this, I was actually, in fact, I stopped doing it with one of the teams because they told me, well, you can do this, but we want you to buy 5 figures worth of advertising. And I said, I just didn't think it was right, but at least not for me. But the thought is, so here's the thing. The thought is that the thought is that people, maybe some athletes don't necessarily trust the owners because they figure the owners want to win and maybe don't care as much about the athletes' bodies. Not saying that's true, but some athletes feel that way. And then the thought is that the team physician is part of the ownership establishment. And so the thought is that they're on the side of the ownership, not the player. So, and I'm not saying that's true either, but that perception can exist. And so what has become increasingly common is that players very often. I mean, I think Mitchell Trubisky did, yeah. So, and you know, I know who the doctors are for the Bears, and they're all very good doctors. But Mitchell Trubisky went to see Dr. Oh gosh, Al.
Los Angeles.
Yeah, blanking on his name. Begins with an L, but he's a real good. Gosh, anyway, he's a great guy. He's a very good doctor. And went to see him for a second opinion, and at least it was in the media. The second opinion sort of agreed with the first. But players these days, I mean, there's two things. Number one, players will get outside opinions. Number one, because they'll think that there's somebody who's just, you know, the best person at what they do, and not to say, like, you know, there's a guy named Mark Philippon, example, who's the he's a hip arthroscopy specialist, and he's a friend of mine. Wrote a chapter for my ACL textbook, actually, because the relationship of hips to ACLs, and is I took a family member of mine to him because he's clearly the best there is. So professional athletes from all over the world come to him. Not to say that there aren't other people who can do what he does, but you know, if you want the best in that field, you go to him. And so people that can be perceived in other areas as well. And so the thought is, well, you go to somebody who you might think, hey, my doc's good, but this doc's better, you know, or so you think. And also you think this doctor does not have a vested interest in getting me back on the field. Mm-hmm. So people go for second opinions, you know, a lot. So, yeah, I mean, so getting back to the original point, and actually, I think it's a good thing, because you just never want to be in a position where you're having some doubts as to why things are done the way they're done.
So you bring up Mitchell Trubisky and Dr. Chad Prodromos on the Sports Medicine Weekly Update, Jerry Riles. You bring up Mitchell Trubisky, and he started, as of the recording of this podcast, he's starting for the Bears against the Green Bay Packers on Sunday Night Football. And a lot of speculation surrounding that decision by Matt Nagy revolves around and centers toward the two shoulder injuries that Mitchell Trubisky had. He injured one shoulder last year. I think that's the left shoulder, and then the right shoulder this year in the game against the New Orleans Saints over at Soldier Field. And he mentioned he went to get a second opinion from a doctor out on the West Coast in Los Angeles. And apparently the Bears felt comfortable with it. He felt comfortable with it. And with the unfortunate situation that happened with Nick Foles, he's going to get the start. No NFL player playing at this level is never 100%. But how effective regarding Mitchell Trubisky, and they talk about his athleticism continuously week in and week out when he's out on the football field, how effective do you think his play could be, having sustained injuries in both shoulders and trying to be, you know, productive at a very, very high level?
Great question. By the way, the doctor whose name escaped me it's Alatrash in Los Angeles. We saw. Yeah. Great doctor, great guy. Anyhow, so here's the thing. So first of all, Mitchell Trubisky had a left shoulder dislocation last year, and they wouldn't let him run anymore, and he had surgery, and he's doing fine. But as I've mentioned before on this show, surgery, it's usually called an arthroscopic Bankert repair for shoulder dislocations, are not a slam dunk. And the Bears have two examples. Anthony Miller, the one, and then Jalen Johnson, the rookie cornerback, the other, who had that problem, had an initial surgery, had a recurrence of the injury, and had a second surgery. And half of them are doing okay. So Mitchell Trubisky has not had a recurrence, but that's his left shoulder. But it's higher risk. I mean, the success rate regarding recurrence, for example, is much higher. It's not high overall, and depending on the statistics, but it's probably in the 15% range. I don't know, something like that. Depends what you read. It's higher, for example, for a dislocating shoulder than it is for an ACL tear recurring. Anything can recur. But so anyway, so first of all, he's at some risk of that. By all accounts, he's been fine, but he's at increased risk, I think, for the left shoulder. For his right shoulder, a couple of years ago, he missed 2 games with what was an AC joint injury. That's the acromioclavicular joint at the top of the shoulder. We talked about that. Not a separation or dislocation of it, but a lesser degree of injury that kept him out for a little, and he came back. And so I don't know what he did this time, but I know he fell on it. And the commonest there's a couple of common things that happen if you fall in. One is an AC joint injury, and one account afterwards said it was similar to his other one. So whether that reporter knew anything, I don't know. But if so, it would be another AC joint contusion or sprain, let's say. Or you can just contuse the deltoid muscle in the rotator cuff. But here's the thing. I mean, I don't gamble, because I'm not smart enough to gamble, and but I don't know. I mean, if I were a physician for the Bears, and if they were asking me, and with having had his left shoulder dislocated, surgically fixed, and with having, his right. So here's the thing: if he fell on it, if it is another AC joint sprain, like a grade 1 or 2 injury, we call it, he's at increased risk if he falls on it again to dislocate the joint entirely. So, gee whiz, I mean, if I were the team physician and they asked me, well, can we let him go out there and run? What do you think? I would tell them, not my decision, but is he at increased risk for both shoulders? I think so. And furthermore, the right one, probably doesn't feel perfect even now, right? So I mean, if I were a betting person, I would probably be betting that I don't think he's going to be running around a whole lot. And actually, what's even worse about that is that, I mean, he's a tough guy, obviously, and I'm guessing that shoulder, even though he can play, probably doesn't feel terrific. So if he just stays in the pocket and throws, sometimes when he runs around a little bit, maybe gets a little easier. I don't know. But I would guess they're going to be protecting him some. And I'm thinking if I'm Mitchell Trubisky, too, there's a lot of talk after he was hurt. Some people were saying in sports talk, if I'm his agent, I'm telling him don't come back, because all you do is go out there and get injured. You won't get another shot. But I don't know. He's got a chance to prove himself. So it's got to be tough on him, too. I think on the one hand, there's a chance to prove himself. And he's probably a little better when he's running around. But on the other hand, if he runs around and gets hurt, no good either. So I think he's, I admire his toughness. I think it's a difficult spot for him.
No, there are a couple questions that come to mind based on, and great breakdown and great analogy. I don't know which question to ask. What the one question is, do you think that the Bears, because the situation is it's delicate, I would imagine. On the one hand, because you said the recurrence of injury can happen, and we saw that when he injured the right shoulder against the New Orleans Saints, it looked like just a regular football play. It was a sweep that went bad for the Bears to the left, and he got hit and he was tackled. He got up and he ran off the field. It was clearly for just one play, and then we learned about 10 days later that he had injured, the shoulder. And based on what you just shared with us, constant contact and constant hitting against the Green Bay Packers can result in, the same thing, injuring that shoulder again. But that's one of the questions. And the other question is, do you think that the Bears are in a tough spot because they got two quarterbacks who are both injured and they take the lesser risk of the other one, meaning Nick Foles have that hip pointer and Mitchell Trubisky has the shoulder? We have a better chance of succeeding with Mitch out there on the football field as opposed to Nick Foles. I mean, there's a lot there, and I know fans are wondering and thinking and scratching their head,
And I'll tell you another thing. I'm just thinking, you mentioned, does ownership get involved? So I'll tell you an interesting thing with the Bears are concerned. So George McCaskey runs the team, as everybody knows. But, another member of the family who's been involved with them for a long time is Brian McCaskey. Mm-hmm. And 30 years ago, I got to know Brian pretty well. Brian is a certified athletic trainer. People may or may not be known. And he actually was a trainer for the Bears back in the 80s. And, I know Brian to be a stand-up, bright, conservative kind of guy. So, I think that, and I don't know if he's involved with the team or not, but I'm sure he is to some degree. So I think, with him being involved, there's even less chance that ownership would advocate anything, just because he's a stand-up guy. As far as with the two quarterbacks, I mean, who knows? We might see Tyler Bray out there. I don't know. I mean, my guess is Mitch Trubisky is mobile enough to play and keep himself out of trouble, I think His legs are fine. Presumably he can throw. So, he's probably a better bet. A guy like Nick Foles, if he can't move, and he's not a running quarterback anyway. So if someone who wasn't that mobile to begin with, and with a lot of their offensive line being injured, seems to me he'd be kind of a worse bet to perform well in those circumstances than Mitchell Trubisky.
Yeah, but I believe you probably saw the play where Mitch was hurt. Again, from a fan's perspective, it was literally one play, rolls to his left. The play was botched. He got tackled, and it wasn't a severe or vicious type of tackle. It was a football tackle. And I guess he fell somewhat on the shoulder or whatever the case may be. He gets up, gives the ball to the ref, runs off to the field toward the sideline, and it looked as if in his running motion he was moving without any concern or illness or injury or anything. And then we learned, days later that this guy sustained an injury on one football play. So it kind of, and you talked about not being a betting man. I don't bet much either, but if I'm betting this game, I'm betting against the Bears because I don't think that Mitch Trubisky with two shoulders, especially the most recent one, holding him out, it just seems to me that I can't see him being on the football field for 60 minutes with a shoulder that he injured in a game that he only played one play in.
Yeah, and the other thing about falling on your shoulder like that, and a lot of times it's how you fall and if you can protect yourself too. I mean, just falling even if nobody's on you. But if you can't protect yourself, like, goodness gracious, poor Drew Brees. I mean, like 5 broken, 6 cracked ribs, So, sometimes it's just how you fall if you can't tuck and roll. But the other thing I was going to say is that it's his throwing shoulder. So it's not even, it's not even can you run around out there, but can you run around and throw a football, and it's like a baseball pitcher. If that shoulder's messed up, maybe you can throw, but maybe you can't throw well. So I'm just saying that's part of it too. Not just a question, is he good enough to go out there and run around, but is he good enough to run around and throw, and throw a football accurately?
Yeah, and it's got to be interesting from the Bears' perspective. Of course, Mitch, athletes want to get out there, and you know this. Athletes, they want to play. They'll play until their last breath, and we certainly get that. But again, we talk about his agent and we talk about the ownership. Is it worth it to jeopardize? And Mitchell Trubisky this past week said, "Hey, I want to play in this league for a very, very long time." And I guess the Bears have weighed the options and said, you know what, it's best for him to get out there to keep this season, somewhat alive as best we possibly can. But looking at it from his agent's perspective and from a business perspective. And I know the individual you talked about that said I wouldn't play him because of his future. That was David Kaplan, the great David Kaplan, who joins us periodically. NBC Sports Chicago here in the great city of Chicago made that comment and said, you know what, if I'm his agent, I don't want to start him because I don't want to jeopardize his future as far as the National Football League is concerned. is concerned. I would be very, very leery of putting him out there on the football field.
Particularly since it's away, it's the Packers, the line's beat up. I mean, it just seems like a setup. No matter how well he plays, that the odds just have to be against them.
It's like a setup for disaster, to be honest with you. It really, because they're going to be without Charles Leno Jr. on the offensive line. This is the offensive line that's really much just been duct taped together, put in place, and haven't really even worked together. You're going up against the Green Bay Packers, who are chomping at the bit, one of the best defenses in the National Football League. You got a guy in Mitchell Trubisky, again, 2 shoulder injuries, and he's still not comfortable with NFL defenses, and you don't have a running game. So it's almost a formula for disaster, to be honest with you. It really is. In closing, Doc, there's a lot there. If people want to get a hold of you, if they have maybe a shoulder injury, if they have a knee injury, ankle injury or anything of the sort, how would they be able to get in contact with you and learn more and find out more?
So call my office. It's 847-699-6810. Got a great staff. I have an email that's just ortho, like orthopedic, but ortho at ismoc.net. And we answer all our emails. So always happy to try to be of help.
Sounds good. Doc, did you have an enjoyable Thanksgiving?
Yeah, I had a great Thanksgiving. How about yourself?
I certainly did, and of course, considering the circumstances, it was a safe environment, of course,
Good.
at home, and it was very, very delicious and a relaxing evening, to be honest. And hopefully, we'll have brighter days ahead of us. I know the Christmas, the holiday seasons are coming upon us as well, and we're looking forward to spending a lot of time with family, hopefully friends, whether it's virtual or in person. That remains to be seen, but we want everyone out there to be safe and sound, and practice your social distancing for sure until we can get around this thing.
Right. Absolutely. Great advice, Jerry.
Sounds good. Hey, Doc, you're the best. Fantastic. Stay safe, and we'll be talking with you. Temperatures are supposed to go down, so I think our golfing days for the rest of this year are out the door, my good friend.
Yeah, break out the orange balls, huh? That's
There
right.
you go.
All right, man. Thanks.
Dr.
I'll see
Chapter
ya.
Jomas, thank you so very much. Take care of yourself.
Take care. You too.